Hi, my name's Alex. I'm 30 years old and I live in Norwich in the United Kingdom. Currently in the United Kingdom, we are under lockdown, which means that all non-essential services are closed and non-essential shops, etc. It also means that we are only allowed to make one journey out of the house a day for exercise and then for other essential travel, such as to work or because of going shopping, which I used to like to do. So what does that mean for me personally? So I've recently moved to Norwich from London and I was in the process of transferring my care over. So there was one day, I went out multiple times in one day and actually once to go and receive medication, the other time to take my dog for a walk, and the other time to go to a shop. And unfortunately, that went over the threshold and one of my neighbours did complain. And so since then it's been quite an intimidating experience for me to leaving the house and proving a point as to why I was leaving the house on a regular basis. In terms of more widely, I'm nervous because of coronavirus. It can be quite a daunting thing to think if you've got other health conditions. So I have a liver condition, which was because of the length of time and the amount of medication I've been taking, and also my mental health. So I was diagnosed with anxiety and depression not long after being diagnosed with HIV. Some maybe to do with the trauma, maybe to do with other things, but you know it's problematic, especially if you're stuck in the home on your own a lot. So that's my problems. It's quite difficult. It's nerve-wracking, but actually I'm obviously very lucky. So I'm able to talk about living with HIV quite openly and also about my mental health. So what does that mean in terms of what I'm doing with my community? I'm spending a lot of time talking to people living with HIV who are nervous about COVID-19. So the government sent out a text message to lots of people living with HIV who were undetectable. So people that have a suppressed viral load, so there was no additional risk of coronavirus to them. Being told to shield, which is wrong. And so because of that, there's been some anxiety and nerves around coronavirus and whether or not we should be shielding. We should be locking ourselves away for months at a time. And so I've been spending time checking with people, spending time talking to them and understanding what their challenges are and how me as an individual and as a community we can support those people living with HIV. What my main concerns about COVID-19 in the context of young people living with HIV, I suppose, I'm concerned about the access to services, the access to support, the access to testing. So obviously we have a range of distance testing in the UK, but what can be really challenging is being scared to go out the house, for essential things like going to a doctor's appointment, getting medication. It's quite nerve-wracking walking around on the street and getting challenged. So finding different ways to access the treatment and the services is going to be really important. When we think about co-infection, so I'm lucky because I'm in the UK and I have access to the right medication, so I have a suppressed viral load, and I'm going to live a long and healthy life with HIV. But I'm so heartbreakingly worried about countries where there isn't the level of suppression we have in the UK. So less developed countries, again, with weaker health systems as well. The moment that co-infection becomes an issue between Covid-19 and HIV, so those people with a compromised immune system, we're going to see some really awful effects. And bearing in mind, HIV is still the biggest killer of young people worldwide because they don't have access to the medication, they don't have access to the services. The moment you add a layer of Covid-19 on top, I'm just terrified that if we don't respond to this properly as a global community now, as civil society, we don't understand and acknowledge that this is an issue that needs to be addressed, and it's not just about the fact that developed countries are struggling with this. The moment this hits less developed countries, we're going to have some issues. So my message to world leaders is it's time to step up, wake up, and take part of it as a global community in supporting those countries that aren't going to be able to support their when the pandemic hits them, and they're not going to be able to support the needs of those living with HIV, especially for those without suppressed viral loads. So please, it's time to act as a global community, not be as insular as we have been as countries recently, and work together to find a common answer to this global threat.